welcome. You're watching NDTV. I'm Rishika Barua. This is a special initiative where we have a panel of expert doctors joining us to answer questions on the COVID-19 vaccination. Amid this surge in cases in the second wave, getting the vaccine is absolutely crucial. You must go out and get the jab. So joining us on Living Long and Healthy with COVID-19 vaccination, we have with us today Dr. Abhijit, Senior Interventional Cardiologist at the Cordis Heart Institute, Mumbai, Dr. Deepak Davidson, Chief Interventional Cardiologist at the Caritas Hospital from Kottayam, and Dr. Sushil Tripathi, Interventional Cardiologist at the Aarogyam Heart Clinic from Mumbai. Thanks so much, doctors, for sparing your time and being with us. Dr. Abhijit, to you first. I want to first understand from you this second wave of COVID infections. It's come all of a sudden. What explains it?
See, the sudden second wave which has happened in India is very tragic. This is because of multifactorial. First of all, the double mutation which has happened in India, which is more infectious. Second thing is, you can see that the vaccination and the sudden rise have started almost together. So what has happened is, there is COVID inappropriate behavior which has been seen in people who have taken vaccine. There is a lot of crowding if you see at the vaccination centers. Then after taking vaccination, people are thinking that they have got something like Amrit and they are roaming around. The amount of antibody response that happens after first dose, it generally takes 4 to 6 weeks. So till that time, the person is as susceptible to COVID vaccination as a normal person. So these are the two things I feel are the most important because of which there is a rapid rise. First is COVID inappropriate behavior of the vaccinated patients. And second thing is the double mutation which has happened in the COVID virus.
Dr. Davidson, the most important question then is, given the fact that we're attributing this rapid rise in cases, of course, to human behavior, but also to the behavior of the virus, are our current COVID-19 vaccines in India effective against the new variant?
Yeah. The challenge that's happening at this point of time is you tend to have multiple variants or multiple mutants that's available all over the world. Now, we all hope and pray that whatever vaccines are available at this point of time, it's going to act against the mutants or the variants also. The reason being, whatever vaccines you have, most of them, they try to produce a protein in your body that is something similar to the COVID-19 protein, so that the B cells and the T cells, the immunity creating cells, that mounts a response inside the body, so that over a period of time when you are exposed to this particular virus, this particular immune response is going to be very rapid, so that whatever virus that gets into the body is removed as such. So now at this point of time, we do not have data that suggests that all the mutant variants are going to be protected by the vaccines that's available at this point of time. But still, we sincerely pray and hope, because there is no drastic change in mutants. No drastic mutation has happened at this point of time. So we still hope that whatever vaccines are available, it's going to be effective against these variants too.
Dr. Tripathi, can you explain to our viewers, what is this single or double mutation of the virus? There's talk now of the possibility of a triple mutation as well.
Mutation is a characteristic of any viral illness. So what happens in mutation, when virus replicates, it makes copies thousands and millions in number, which is similar to the original copy. But because it is replicating at such a fast rate and large number, it is bound to make a mistake. So such mutations are sometimes lethal. I mean, they may increase the case fatality, the disease become more severe, or they become more infective, where the transmission from one person to a person another increases. So there are a lot of variation in the world. Some are called as variants of concern, like B117 mutation in UK, B1135 in South Africa. Similarly, these are the single mutations. Similarly, two mutations may occur in the same virus. That is called as double mutation, which has been observed in many parts of India of late, and that increases the infectivity. So the chances of transmission of any person has increased from whatever it was last year. So we are getting more infectivity, and the second wave is spreading at a very faster rate.
Dr. Abhijit, India is now gearing for a third vaccine, the Russian vaccine, the Sputnik vaccine. What more information can you share about this vaccine?
See, the Sputnik vaccine was developed in Russia, and for that matter, they were earlier criticized a lot because they came out for an emergency use of vaccine in their country. The phase 3 trials were not in place also at that time. But now with the safety data which they have, and with the Indian government giving the approval for this vaccine, Sputnik's vaccine is similar to the Covishield vaccine. What is the Covishield vaccine? It is adenovirus. So what actually vaccine, we need to understand what is the vaccine. So the common cold virus is called as the adenovirus. So on that adenovirus, the corona has a lot of proteins. One of the protein which corona has and which is very important for infecting us is the spike protein. So what do they do is they attach the spike protein to this adenovirus or the common cold virus, and that is injected in our body. So how Sputnik vaccine is different than Covishield vaccine? So for the 2 doses which they are giving, they are having 2 different adenoviruses. So the adenovirus 1 and adenovirus 2. So in the 2 doses that we get in Sputnik, both the adenoviruses are separate. So what is the advantage of that? The body's immunity will not destroy. So suppose you give adenovirus 1 during the first dose, the body will have immunity against that adenovirus till the time you get the second dose. So it will kill the carrier adenovirus also, which is not going to be harmful for us, but it is carrying the spike protein. So there are chances that it destroys that adenovirus also. So what they have done is in the second dose they are using a second adenovirus. Advantage of that is the efficacy goes up.
Dr. Davidson, one of the other commonly asked questions is whether vaccination is safe for people on blood thinners and people who've undergone heart procedures. What's the advice that you give?
Yeah, it's extremely important to know this particular point, because we know at this point of time, over the period of last 1.5 years, we are aware that patients with heart disease, patients who are diabetics, hypertensive, these are the subset of people who are likely to develop complications related to COVID. Now, the mortality in these subset of people are also going to be on the higher side. So, somebody who's got a heart illness, somebody who is on blood thinners, who is on cardiac medications, they need to be more careful. They need to be more wiser. They need to invariably have this vaccination done for them. Now the challenge is, while being on these blood thinners, while being on aspirin, clopidogrel, is there an increased chance of bleeding complication? No, absolutely not. It's a hardly 0.5 ml vaccine. It's being given intramuscularly. So the chances of you developing a complication related to that, chance of you developing bleeding complication related to this particular vaccine is going to be extremely on the lower side. So it's absolutely not an issue whether you're on aspirin, whether you're on clopidogrel. You can straight away go have your vaccination done. You do not have to stop your medicine. Now the challenge comes with warfarin. When you're on anticoagulation, when you're on warfarin or acetylene, make sure that you do not develop bleeding complication by just checking your prothrombin. Just make sure that your INR is below 3. Once your INR is below 3, the chance of having a bleeding complication is going to be on the lower side. Just be careful regarding the INR values. That's all, Tanisha.
All right, I think that's a very important clarification that you've just issued. On that note, we're going to slip into a very short break. Our panel of expert doctors will continue to be live with us on the other side. Stay tuned. Welcome back. You're watching Living Long and Healthy with the COVID-19 vaccination. Our panel of expert doctors continues to be live with us. Dr. Tripathi, if I can ask you, is the vaccination safe for patients with long-term heart disease as well as diabetes?
Well, all the vaccine trials which have been conducted, they have been conducted across all the general population, which also includes patients with cardiovascular disease and diabetes. And it has been found that it is absolutely safe in those subsets of patients, like patients who are having heart disease, stroke or diabetes. And in fact, I would say it is more essential for them to take the vaccine, because we have seen even the risk of infection is same, but the chances of severe COVID or critical COVID or the death rates are higher in these subsets of patients. Therefore, it is very important that they should be vaccinated on a priority basis. And as far as safety is concerned, all patients may develop some minor side effects like pain or swelling at the local site and fever, headache or fatigue, which will subside in a day or two. And there is no need to stop any of the medicines, like patients who are taking their blood pressure medicine, cholesterol medicines and diabetes medicine. There is no need to stop. And if patients are on blood thinner like antiplatelets, again like aspirin, clopidogrel, there is no need to stop these medicines. For the patients who are taking anticoagulants, they need to contact their doctor before stopping.
All right, I think that's an important clarification as well. Dr. Abhijit, why should people with heart disease or who have had a heart attack or a stroke in the past get the COVID-19 vaccine?
So any comorbidity, if a person gets COVID infection, the body is not going to handle the COVID infection very well. So the chances that the patient slips into ICU, goes on a ventilator and complicates because of COVID infection becomes very high. So any comorbidity like heart disease or brain disease, it is very important that these patients should be taking vaccine as early as possible, because any COVID infection with comorbidities, definitely the chances of mortality and complications related to COVID are very high. So patients with heart disease and stroke should definitely take vaccine as early as possible.
All right. So in fact, clear all doubts and go out and get the vaccine as early as possible. Dr. Davidson, do blood pressure lowering or lipid lowering medications affect the vaccine?
Absolutely not. Presently, the data says that none of these medications can affect the efficacy of vaccines.
Right.
So probably when somebody is on antihypertensives, when somebody is on lipid lowering medication, cholesterol lowering medication, they need to continue these medications as they go for this vaccination purpose. Now we also know that the lipid lowering medications, they do have some protective effect. They have anti-inflammatory action, so they might protect against the virus also. So one should be very careful not to stop these medications. Secondly, regarding the blood pressure medication, there are at least a subset of people who go for vaccination. They do develop fever. They do develop some sort of giddiness and syncope or blackouts. Those subset of people, probably 1 or 2 days, one should try to avoid the BP lowering medications, because the chances of BP going further down with fever and these sort of symptoms are on the higher side. So following vaccination, if you have fever, if you have giddiness or if you have blackout, probably one should skip a couple of doses of blood pressure lowering medications.
Right. And Dr. Tripathi, once again, a question on, patients who've undergone bypass surgery. Is the vaccination safe for them? Is there any kind of medication which is a contraindication?
Well, the patients who have undergone surgery like bypass surgery or heart valve surgery, it takes time for their wound to heal and for them to completely mobile and ambulatory. So maybe around 4 to 6 weeks we can wait for them to be completely mobile, and then the vaccine can be given. At times during this period when they have not received vaccine, they can continue wear mask and avoid social gatherings, maintain physical distance, sanitize their hands. This will not only prevent them from COVID infection, but from many other microbial infection which can complicate their wound. Maybe in 4 to 6 weeks time they can take vaccine as usual as anybody else.
All right. I think that's a very important clarification. It's a very commonly asked question. Dr. Abhijit, there are a lot of viewers who've also asked questions about whether they need to quarantine after they've been vaccinated if they have been identified as a close contact to someone who's contracted COVID-19. So if you are a high-risk contact of a COVID-19 patient, but you've got the vaccine, do you still need to quarantine?
See, the most important thing is how many days after vaccination. So if you are like 15 days after second dose, then definitely you are safe. And if the person is asymptomatic, if the person who has is a close contact who has been vaccinated, he doesn't have any symptom from his relative, like his relative is COVID positive, but the vaccinated person does not have any symptoms. He is totally asymptomatic. In that scenario, he does not need to be quarantined if he is 15 days after the second dose. So after 15 days after the second dose, you are safe. you need not be quarantined. But if you are in middle of first and second dose, then the immunity status is not very sound, and that's the reason you need to be quarantined. But 15 days after the second dose, you are safe if you are asymptomatic.
And Dr. Abhijit, just a quick follow-up question. What if you develop symptoms?
If you develop symptoms, then definitely you need to get your RT-PCR done. And if your RT-PCR comes positive, you need to be quarantined. There is always a chance that even after vaccination, you can get COVID infection. But the most important benefit of vaccination is that you will never die, because you have some amount of immunity in your body, and that's the reason you will have mild symptoms, or maybe you can be treated at home. So you need not be hospitalized also. So the chances that a person dies, even if he gets COVID infection after vaccination, very low. So therefore vaccination is a must for everybody.
Dr. Davidson, another commonly asked question by those who have been given the vaccination is whether they still need to wear a mask and avoid close contact with others if they've received both doses of the vaccine.
Yeah, it's a very interesting question. We just heard from Dr. Abhijit that all these vaccines, it's not going to be 100% protective. We know that whatever vaccines are available in India at this point of time, it's only 60 to 70% protective. So we know that at least few of the people who are vaccinated, they do develop infection in future. So it's only, you tend to have only 60 to 70% protection. Once you develop infection, you might not be quite symptomatic. You might have mild symptoms. You might go home. You might infect your dear and near. So you might infect your friends also. So it's extremely important. In spite of receiving 2 doses of vaccination, in spite of having a couple of weeks beyond the second dose of vaccination, still you are likely to have the infection. You are likely to contract the infection. So it's always mandatory that you need to be very careful by masking, social distancing and hand washing.
So Dr. Davidson, if I understand you correctly, what you're essentially saying is after you've received both doses and 2 weeks have passed, you can still get COVID, but the symptoms may be very mild. So you could be an asymptomatic carrier and you could potentially infect someone else. Is that correct?
Very true. Very true.
All right. So you still have to be very careful, follow COVID appropriate behavior even after you've got the vaccination for the sake of those around you who perhaps haven't yet got the vaccination. Dr. Tripathi, now this is a question that has been asked very commonly. People want to know whether you get some level of protection after the first dose and how long after the second dose are you actually protected by the vaccine?
See, whatever the vaccine trials have been conducted across the world, the effectiveness, the efficacy was told to be around 70 to 95% depending on the type of vaccine and the region. After the first dose of any of these vaccines, you'll get a good response in 3 to 4 weeks or 4 to 6 weeks. But the exact response, immune response develops after at least 2 weeks of the second dose.
Right.
So after 2 weeks of second dose, you can expect a good immunological response from the vaccine, and you are protected from the infection or the mild to moderate illness, and these vaccines do prevent from the severe disease and death. That is what is more important.
Right, but you are still considered a high risk if you've got just one shot, because there are several cases being reported also of people who've got one shot of the vaccine and then they get COVID. So you're saying that the level of protection is not that high after one shot. Is that correct?
Right, yeah, you are right. After second dose, at least 2 to 4 weeks after the second dose, then only the prescribed efficacy rate of that vaccine is considered to be there.
Okay, so that's very important advice that only 2 to 4 weeks after you've received the second dose of vaccination, does the antibody response actually kick in? Does the efficacy of the vaccine actually kick in? Before that, you could still get COVID. Even after, you could still get COVID, but it won't be life-threatening. Thank you so much, doctors, for issuing some very important clarifications on the vaccination. Thanks so much for joining us.